Hi there, my name's Trishan Malhi. I'm a dentist based in Derby and I want to go through two cases where they've got a gap between the teeth and we've closed the gap using clear aligners, specifically spark aligners. So here we've got a patient. She came in last year and she was always didn't like this gap between the teeth, and I used spark aligners to close the gap. And this is her teeth. Took 6 months. This is her teeth afterwards. So we've closed the gap there. That's a before. That's a after. This is a before. So the upper arch, you can see a gap between the teeth here. And this is her afterwards, and she's got the wire retainer on. How do we do it? Well, with spark aligners we use their approver software, and she used a set of clear aligners. It took 24 weeks to close that space, and this is how we go about doing it. So when you've got a gap between the teeth, there's two ways to close the space. Either you bring the teeth towards each other, or if your teeth stick out, you can use that gap to bring the teeth back. Now in her case, the teeth didn't stick out too much, and so we redistributed the space here and here. So we're closing the space, closing the space, closing the space, and we redistributed the space to this side and to this side, and then we used white filling material to build up this tooth because this was small in proportion to this tooth. And on this side again, this tooth was small in proportion to this tooth. So if I go through this here, since COVID, I've been treating more and more people with aligners rather than fixed braces, because the technology with aligners nowadays has come on leaps and bounds, and it can treat more complicated cases. So the final result for this lady is the gap is closed at the front. I then built up these canine teeth slightly wider to close up the residual space. So with her, we redistributed this space from here to there and to there. And so on the photos, you can see I've built this area up, and I've built this tooth off. So that's a side view of her teeth before, and this is after, and you can see I've built it up wider, this tooth. Side view of the teeth before and afterwards, and I've built this area up a bit wider. So redistributed the space. Took 6 months, and she was overjoyed with the results. On to our second case now. So this was a young lad, about 20 years old, came in last year, didn't like the gaps between his front teeth, and you can see he's got narrow side teeth here, and he's got these gaps here that he didn't like. Again, he didn't want to wear a fixed brace, so we used spark aligners to close the gaps. And again, what I did was redistribute the space around these lateral teeth. So close the space here and redistribute the space around this tooth, and then build them wider with composite filling material, or what's called bonding. So this is the before, this is the after. So we built these teeth wider. Here's the before. You can see the gaps here, here. Here's afterwards. So you can see a bit of the bonding is here. The bonding is here. We put a wire retainer behind the teeth. This is just a bit of trauma when we were trying to, put the bonded retainer. But that'll all heal up fine. Here's the before, looking at the left side. You can see the gaps. This is afterwards with the bonding, closing the gaps. Gaps again, and closing the gaps. So how do we do it? So we use spark aligners first, and I'll play the simulation. Again, it took half a year to do this treatment. It's a fantastic product using spark aligners. Gets the job done. And we redistribute the space here and here, and then built up these teeth wider because they're narrow teeth. So you needed 25 aligners. So here we go. So it's got spaces everywhere around the upper front teeth. Use the spark aligners, move these teeth in the right position, and then use the space, bring the teeth back, but maintain the space around these lateral teeth here and here. So at the end of braces, he had a spacing here, he had some spacing here, which was deliberate because I wanted to make these teeth wider, because these teeth look wide and these teeth were too narrow. So we used bonding then to build up these teeth wider and build up this tooth wider. And I'll just go back into the, there we go, we used bonding to build these teeth wider. Took 6 months. We then put a wire retainer behind the upper front teeth to keep the gap closed. And he wears a removal retainer every night, and that's how you maintain the closure of the gaps.